Hi, I'm Chanel, one of the journalists at Manx Radio. Welcome to the latest edition of Manx Radio Newscast.
Sure. My name is Joannis Vamvakopoulos. I'm a consultant endocrinologist and the clinical service lead for the endocrinology and diabetes service on the Isle of Man. So the week runs from the 20th of May to the 26th of May, and the type 2 diabetes bit is about increasing awareness of how common it is, what it means, and how to avoid it.
And what is type 2 diabetes?
It's a metabolic condition. The liver becomes quite resistant to the action of insulin, insulin being a hormone that gets sugar from the bloodstream into the cells so that energy can be made and we can move around. The problem with type 2 diabetes is that, yes, as I said, the liver becomes resistant to insulin, which means that the pancreas, which makes insulin, has to work harder. And over time, the pancreas fails. That's what we call end-stage type 2 diabetes, which is roughly where people require insulin treatment.
On the island, do we know how many people have type 2 diabetes?
Yes, the latest numbers come from a census in primary care, which took place in September 2020. They counted about 4,700 people at the time, representing about 5.3% of the local population. We reckon that currently we have roughly 5,000 people with diagnosed diabetes, about 10% of which, so roughly 450 of which have type 1 diabetes. Taken together, this amounts to about 6% of the local population. So the sugar intake part of how diabetes comes about pertains to how many calories you consume, basically. The action of insulin is to get sugar into the cells. What happens then is that if you move about, your cells make energy out of sugar. So you burn it up, you expend it as heat and as kinetic energy, effectively. If you don't burn it up, so that's where the sedentary lifestyle comes in, then insulin actually promotes fat growth. Okay. And the reason type 2 diabetes actually comes about is because we are all born with a certain amount of fat tissue, which you can think about as a set of shelves, a storage space for fat. When you fill up that storage space, the body continues to make fat, okay? But it stores it in the wrong places, and those wrong places are typically the liver and muscle tissue. Now, when you have fat in the wrong places, that causes dysfunction of those tissues, the liver and the muscles. That's how they become insulin resistant. That's how type 2 diabetes comes about.
So what should people then be looking out for?
With severe metabolic dysfunction, so with full-blown diabetes, if you will, you end up with high blood sugar levels. This causes, well, first of all, that causes sugar to overwhelm the recycling capacity of the kidney. So the kidney normally recycles all the good stuff from the urine, the good stuff being protein and sugar. When you have a very high blood sugar level, the kidney is overwhelmed and a lot of sugar spills out into the urine and draws water with it. So people should look out for an increased urinary output, which means increased urination. Obviously, that will make you thirsty, so increase thirst as well. And these are what we call the osmotic symptoms. In very severe cases, you may get blurred vision as well, and feel quite unwell to the point where you have to come to hospital.
Yeah, you also want to speak about gestational diabetes as well.
Gestational diabetes is simply diabetes in pregnancy. Now, you may have type 1 or type 2 diabetes pre-existing pregnancy, so a lady can fall pregnant when she has a previous diagnosis of diabetes. But by gestational diabetes, we mean a new diagnosis of diabetes during pregnancy, which typically goes away after delivery. So there are specific criteria for diagnosing gestational diabetes, which are different from the broader ones for diabetes. The reason they are different is because, put simply, two people are at risk here, both mother and baby, and we have a lower threshold for making a diagnosis and suggesting treatment. So roughly 4 to 5% of pregnant ladies have gestational diabetes, and that represents about 1 in 20 pregnancies. It is becoming more common.
In terms of the foods that we eat nowadays, you always hear, and I don't know if this is myth. If this is a myth, you can bust it if it's a myth. But a lot of people say because of the stuff that we're getting in our foods nowadays, your body is more at harm to all of these things. Could it be true?
Almost regardless of the type of diet you follow, it is really hard these days to avoid carbohydrates. That is because an overwhelming majority of foods are processed, and in the processing, a lot of additives go in to make it more palatable, and those additives typically have carbs in them. So and these carbs, I should add, they go under different names, a multitude of names. So you can have glucose syrup, maltose syrup, maltodextrin, all sorts of names, which wouldn't necessarily make you think of sugar, would they? So it's just that the food has become more palatable, more processed, and that introduces a lot higher proportion of carbs in what we eat.
So do we have to be a little bit more hands-on in terms of, when we're picking the products at the stores?
For sure. Ideally cook your own. But yes, when you go out, it's best that you do the shopping, at least the grocery shop.
Earlier you mentioned ethnicity. Is it different for different groups, race groups or ethnic groups?
For sure, and I should perhaps just take a step back here and just outline the risk factors for diabetes in general. So in general, we're looking at age, ethnicity, and BMI, body mass index. I should also caveat that the body composition also plays a role, and BMI and body composition are not exactly the same. Body composition refers to the percentage muscle mass versus water and percentage fat. So there are things that you can't do much about, age and race, ethnicity, and there is one thing you can do a lot about, which is your body composition and the BMI. In terms of ethnicity, typically the prevalence of diabetes in the Black and Hispanic ethnicities is about 12%. Southeast Asian origin, it's about 9%, and in Caucasian whites, it's about 6 to 7%. So there are genetic factors in addition that determine these things. In terms of the class of body mass index, data from the UK, Office of National Statistics, suggests that if you have a normal BMI, there's about the prevalence of diabetes is about 3%. If you're overweight, it goes up to 5%, and if you're frankly obese, so BMI over 30, it goes up to 11%.
These stats, are these for the UK or is this worldwide?
The UK statistics are typical of Western countries. There is a wide variation in the quality of data around the world. I think the best data I've seen are through the IDF, the International Diabetes Federation census. The latest data are from 2021, and they are sort of surface level data. So they give the numbers of people affected by diabetes globally, which is about 540 million, and global deaths from diabetes-related causes, which amount to about 6.7 million. The unseen diabetes is what we worry about. Once it's diagnosed, there are specific guidelines for managing diabetes. I should say at this point that a lot of diabetes management is down to the individual. There is no magic wand that I or your GP can wave to make the diabetes go away. Any medication we prescribe for type 2 diabetes short of insulin should be viewed as a crutch to buy people time to turn around their lifestyle, lose a bit of weight, change the body composition, change the eating behavior pattern so that the diabetes can go away. When you get to a stage where you've accumulated 3-4 tablets and then you go to insulin, I'm afraid you've missed the bus.
I was just going to ask, can diabetes be reversed?
Yes, it can. Within perhaps the first 3 to 5 years, there have been studies purely with dietary manipulation, very low-calorie diets. That's not factoring in exercise at all. There's a lot you can do with exercise for type 2 diabetes in changing the body composition. So increasing the metabolically active muscle mass and decreasing the metabolically inactive fat mass.
What advice do you have for people that are diabetic, that's listening to this, and they're now determined to kind of change it around? What would you advise them?
Don't rely on medications. When you're given a diagnosis of type 2 diabetes, usually your doctor will take into account your family history, body mass index, and how you present, the symptoms, and you know what this is likely to be. The moment you receive the diagnosis, the first thing you ought to do is take notice, hit the gym, and get the weight down.
Do you have any concerns in terms of diabetes or type 2 diabetes?
Concerns, but yes, that takes us back to the iceberg. So I've just described the tip of the iceberg. So there are data out there of undiagnosed diabetes. There was a recent paper in the journal The Lancet, citing data from the Office of National Statistics in the UK, saying that about 30% of people with diabetes are undiagnosed. So whatever numbers we know, add 30% to that. Pre-diabetes, the prevalence is estimated to be at around 11%. That's in addition to the 6 to 7% overall prevalence for diabetes in the UK. So roughly speaking, pre-diabetes and diabetes in the UK is about 18%, actually. The CDC in the United States mentions that about 28% of Americans are undiagnosed diabetics. And globally, the International Diabetes Federation estimates that about 50% of people with diabetes are undiagnosed. Obviously, that's because of the quality of healthcare in different places around the globe.
That's crazy.
It is crazy.
Is it because maybe people don't notice the symptoms in themselves and that's why they're not getting it tested or checked?
You may have heard the expression the silent killer. So I think that was coined for hypertension initially, but it applies to diabetes. When you get symptoms, you're already further down the line. Okay, so you need medication at that point to control the symptoms. And that's not to say that you will stay on the medication, but things have gone far enough for people to manifest symptoms. And if that's not a wake-up call, I don't know what is.
I think my last question would be, how often should people then be testing their blood sugar levels?
People without a diagnosis of diabetes.
Yeah?
I think there's a fairly good case for a national diabetes screening program, given the implications for health. I was thinking about it in terms of UK. Could it happen on the Isle of Man? I would like to see other things happen first, if I'm honest. But yes, there is definitely a case for a national screening program, perhaps targeting higher risk group, those who carry a little bit more weight, those with a family background of diabetes, that sort of thing. When thinking about undiagnosed diabetes, actually it's the younger demographics that are more undiagnosed, which is quite worrying. Now, I'm not here to fearmonger, and I don't advocate that people live their lives in fear, but I believe in personal responsibility.
Thank you for making it to the end of the Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider so our best bits will magically appear on your smartphone. Thank you.